Hi, I'm Bruna. Our paper is Approaches for Tailoring Between Sessions Mental Health Therapy Activities, also known as homework, which can help people with depression and anxiety. Depression and anxiety affect over 16 million American adults each year. About 1 in 5 received mental health treatment as of 2021. In many behavioral therapies, therapists and clients work together to set goals and plan activities that the client completes between therapy sessions. Those activities are called homework. There is evidence that engaging with homework helps clients develop skills that help them manage their mental health, and there's evidence that it helps improve depression and anxiety symptoms. Therapists and clients decide during the therapy session that the homework is going to be. Then the client works on the homework between sessions by themselves. Homework can take many formats. One of them is worksheets that you can see examples on the left side, where clients can do activities such as reframing unhelpful thoughts, and there are other behavior homework too, such as going for a walk or self-tracking their mood. Several apps offer the type of activities that therapists use as homework, such as scoping tools when the user is stressed, or journaling and writing reflections. To be most effective, therapy homework requires tailoring activities to the client's needs, values, and long-term goals. If a good tailoring does not happen, barriers come in the way when people are doing homework. In fact, only 20 to 50% of clients end up engaging with homework. Some of the barriers clients face are not feeling motivated enough to change, or the homework might need more time than they have available to complete. For example, a therapist might ask a client to walk 30 minutes every day, but the client might feel too depressed to leave the house, or they might not have 30 minutes available to go for a walk anymore. To overcome barriers, clients and therapists do a lot of tailoring of homework. But in our research, we wanted to understand what and how the clients and therapists tailor homework to those barriers. In technology, systems have started using sensors to capture contextual data, such as location, motion, sleep, and social context. Systems have also aiming to predict people's moods or stress by information based on those sensors, such as recent calls, social media posts, or typing patterns. However, tailoring recommendations for mental health activities based on context is still limited. So we wanted to understand how can technology help clients and therapists tailor therapy homework or digital mental health interventions to clients' everyday context, specifically when clients and therapists are not together in session. For our methods, we conducted semi-structured interviews with 13 therapists and 14 clients with depression and/or anxiety. We also used the Miro board where participants could brainstorm about challenges they face with homework and potential solutions they envisioned. We now here present the challenges that therapists and clients find between sessions and the approaches to tailoring they usually use to deal with those challenges. After the therapist and the client define the homework, the client finds challenges in engaging with that homework during the week. Ideally, the homework would be tailored according to the challenge during the week when the client and the therapist are not together in the therapy session. Here are the main challenges in engaging with homework. Homework is difficult. There are external barriers that hinder the ability to engage with homework, and homework is uncomfortable. Next, I'll give some examples of what participants said about those challenges and approaches to tailoring to those challenges. Sometimes, once the client is at home without a therapist, they might realize the homework is too difficult for them to complete. If the homework is difficult, an approach to tailor the homework could be to adjust duration or frequency of a behavior, or adjust the homework to the client's lack of knowledge or too much knowledge for the homework on how to do the homework. So, for example, here we have tailoring the duration or timing can be helpful for clients if they need to delay a behavior. Therapist 4 said, from eating disorder treatment, rather than goals having to do with not purging after a meal, we'll set delay goals. So, can you delay purging by a certain period of time? Maybe the client's goals is to reduce the frequency of drinking, and their homework was to abstain from alcohol for that week. But the client ends up drinking earlier that week. So therapist 3 said, to adjust the frequency of a behavior, could we just reduce your risk of harm for the week? Maybe we're going to drink, but could you drink a maximum of 2 drinks a day for the rest of the week? Sometimes homework can be difficult if the client does not have enough therapy experience or knowledge, or too easy if they have more knowledge. For example, client 7 said, these workbooks, it seems like some of these things are too elementary. They are not challenging enough. And maybe this is because I'm not new to therapy. One way to adjust the homework for a client that has more knowledge is to add novel elements or make it more engaging. Client 7 said, when I've been in the therapy session and they given something where I gained some kind of aha moment or a new perspective about something that can create the motivation to be able to explore the homework a little bit more. Participants said that often the original homework set in therapy was no longer feasible between sessions due to barriers in their lives. For example, if they got too busy to go for a walk. In those cases, therapists thought it would be useful to have homework alternatives with a similar role to the original homework. For example, therapist 11 said that if they cannot go on a walk, can they dance for one song every day? We want to find some sort of movement. I don't care what kind of movement it is. Usually, therapists offer alternatives to clients after they experience difficulty completing the homework. But by then, it is too late and that moment and homework opportunity is gone. Therapist 7 imagined that a tool could provide alternatives automatically between sessions. The therapist 7 said, if we chose a goal that was not achievable that week, they could choose like that similar one without my input. And sometimes external barriers include other challenges that the therapist does not have expertise to deal with, such as lack of childcare or not having access to a computer. Participants also discussed the difficulty of getting external resources, specifically to overcome external and structural barriers that clients faced. For example, therapist 9 said, I think that's something that's hard to manage outside of the session, either for there being a lot of nuance to it, or we can't give our clients $10,000 to pay all of their debt and be able to take some time off work to better their well-being. Next, if homework is uncomfortable, which is common for clients with depression and anxiety, an approach to tailor the homework could be to create a comfortable space. For example, needing time before or after the homework. Client 8 said, I'm going to need that time afterward to really recenter. It's that the homework brings up uncomfortable feelings. Another way to try to make homework less uncomfortable is to surface homework benefits. Therapist 3 said that they try to do that, but it doesn't always work. Patients don't always see this really is going to pay off in the long term, but I can't get them that long-term payoff, that positive feeling that's going to come down the line from reducing their symptoms early on. So lessons learned in this study from client and therapist practice to tailor homework give us insights on how technology could better support tailoring of digital mental health activities. Technology can support tailoring of those mental health activities that happen between therapy sessions or when the individual is not near a therapist or expert. In that context, the criteria that therapists and clients would like to use to tailor the activities are individuals' expertise or knowledge level with different types of activities, location and social context, and includes appropriate timing to do homework or inappropriate timing to do homework, low motivation, and discomfort. The way the activities could be adapted to the user's needs are changing difficulty of therapy activities by timing, duration, or frequency, or user's knowledge. Surfacing user values and benefits of activities, and identifying alternative activities. And the context, specifically the temporal engagement and the environment, could be adjusted around the mental health activity to support the person's discomfort. In summary, in wanting to understand how technology can support tailoring mental health therapies between therapy sessions, these are the main discussion points of our paper. Please read out our full paper for more information in the SIGCHI 2024 proceedings, and feel free to contact us by email. Thank you.